All right. Again, welcome everyone. My name is Lauren Wilson. I work at the Christ Hospital within our Corporate Health Solutions Department. Thank you for joining us today for the Your Life, Your Health seminar series featuring Dr. Palmer. I will do a little introduction of Dr. Palmer, but first like to start off with some housekeeping rules. Everyone will be muted throughout the duration of the seminar. If you have questions or comments, please feel free to put them in the Q&A box found at the bottom of your screen. Dr. Palmer will be answering your questions at the end of the seminar, so feel free to type your questions or comments throughout the presentation. Little introduction. Dr. Palmer was born and raised in Pittsburgh. He graduated from Carnegie Mellon University with a bachelor's in biology, moving on to medical school, graduating from Drexel University College of Medicine. He completed his residency training at Allegheny General Hospital in Pittsburgh and served 3 years as an orthopedic surgeon in the United States Air Force at Wright-Patterson Air Force Base in a deployment to Afghanistan. After fulfilling his duty service commitment, he completed an orthopedic sports medicine fellowship at Cincinnati Sports Medicine and Orthopedic Center. He has been with us at the Christ Hospital since 2018. His practice is focused on hip, knee, and shoulder conditions. He also has a special interest in hip preservation. He serves as our medical director of musculoskeletal service line at the Christ Hospital, and he is a husband and father of 4, including a new baby girl born on Mother's Day. And with that, I will hand it over to you, Dr. Palmer.
Thanks, Lauren. I appreciate that. Thank you for that kind introduction. Can you hear me okay?
Take myself back off mute. Yes, we can hear you.
Okay, great. So just again, thank you to everyone for signing on and being with us. Our topic today is going to be joint health. And so my plan would be to kind of go through a little presentation for about hopefully no more than 20 minutes or so, covering some high points, and then allow some time for question and answer to make this a little more interactive. So just a basic outline of what we're going to cover. So what is a joint? Why is joint health important? How do we keep our joints healthy? What are some signs that things might be wrong, and when to seek medical advice? So what's in a joint? So a joint's where two bones come together. Could be small joints like in your fingers, could be big joints like your hip, your knee, your shoulder. It's made up of 2 surfaces of articular cartilage, which are kind of like a sponge that act as a shock absorber. They are allow for smooth gliding across each other and are actually, when healthy, almost the smoothest surface on Earth. There's a synovium, which is the lining of the joint that helps nourish the cartilage and everything inside the joint. And it helps keep things in the joint that should stay there, keeps things out of the joint that shouldn't be there. The synovium produces a joint fluid. It's kind of like oil for your motor. It helps lubricate the joint and keep the cartilage nourished. Sometimes there's ligaments inside the joint, like in your knee. The anterior cruciate ligament is a very commonly known ligament that's inside of the joint. And shock absorbers. So again, in the knee, you have a meniscus on the medial lateral side, which are a cartilage surface that acts as a shock absorber to kind of assist the cartilage. And sometimes there's tendons inside of a joint. So tendons are the attachment from bone to muscle, and in certain circumstances, some of those are inside the joint as well. So all of these things can be made up inside the joint. So big picture, why is joint health important? Because unhealthy joints can cause pain. Unhealthy joints can limit your activities. And unhealthy joints can be a marker for overall health. And so sometimes the first sign that something is wrong internally is actually joint pain. And so it's important for your overall health and can be an indicator that something more systemic could be wrong. So how do we stay healthy? How do we keep our joints healthy? Well, it actually starts with nutrition. So best thing to do is just cut out the garbage, right? So avoid lots of carbonated beverages. So cut out pop and other sugary drinks if you can. Avoid a lot of processed carbohydrates, and so stick to simple unmilled or unprocessed grains. Make sure you stay hydrated, lots of water, and a balanced diet of carbohydrates, proteins, and fats. Your gut bacteria and digestion play a very important role in your overall level of inflammation in your body. And so a healthy diet helps maintain healthy gut bacteria, helps limit the amount of inflammation, helps keep your joints healthy. And then staying hydrated helps as well. Weight management is very important. And so one of the longest term studies that was ever done on overall health, called the Framingham Heart Study, looked at people throughout their entire lifetime for a number of different things. And so one of the markers for joint pain that they looked at was weight loss. And so that's the only proven thing that can systemically improve your level of pain in your joints over a long period of time is maintaining a healthy weight. So very important. And that starts in the kitchen. So that starts with diet. And then oftentimes we have discussions about supplementation. So taking certain supplements, is that going to help, collagen or glucosamine or turmeric, tart cherry juice. And so there is some evidence to suggest some of them are beneficial. So specifically kind of tart cherry juice and turmeric have been shown to have anti-inflammatory effects. I'm a little more skeptical about any of the research on collagen supplementation and glucosamine, chondroitin sulfate being more than a placebo, but certainly placebo effect is still in effect. And if it's helping, great. There's really good information on the Arthritis Foundation website regarding anti-inflammatory diets and other ways to stay and keep your joints healthy. And so I'd encourage you to check that out. Same thing with exercise. So secondary, how do we keep our joints healthy is by staying active. So doing something is better than nothing. So oftentimes we kind of get caught up on, making sure that we're doing something perfectly and have to do the right regimen and whatnot. So the biggest point I can emphasize is just do something, get active, go for a walk, walk up and down your steps several times, go outside, just do something. So we often say motion is lotion for the joints. So it's very important for your joints that you stay active and stay in motion. And then another principle of overall health that we say is use it or lose it. So if you're not active and you're not maintaining your strength, you tend to lose muscle and lose bone mass. And so strong muscles make strong bones. So it's very important to stay active and do resistance training as well as cardio aerobic exercise. So my other advice would be to build slowly. Don't go from 0 to 100 miles an hour right away. And so especially if you haven't been active, it takes time to build up your endurance. It takes time for your muscles and your body to adapt and respond to new challenges. So allow yourself time to build up slowly. Some examples of good exercise philosophies or programs include Tai Chi, yoga, Pilates, water aerobics. These are all great things to do for balance and strength, as well as mind and body harmony. And sometimes you need a little bit of guidance and work with professionals. And so physical and occupational therapy is always a good outlet as well. Recovery is also really important. And so for strengthening, for growth, recovery is just important as the exercise itself. And so making sure that you're stretching, that you have, again, adequate nutrition, hydration, that you're icing if you're sore after exercise, and then, consider massage as well for sore muscles. So signs that something might be wrong. Certainly any trauma. So a fall, something falls on you, car accident, you feel a pop. Those are signs that something concerning is going on. So pain. So we differentiate pain from soreness. And so pain, what I worry about is if it's causing you to limp, if it's preventing you from actively using whatever body part is hurting, if it's keeping you up at night, if it is to the point that you're requiring to take medications, that's certainly an indicator that something's wrong. Swelling. So you don't have to have an injury to get swelling, but swelling can be an indicator that something is not right inside of your joint. And so one of the responses to like arthritis could be significant swelling in your knee or your hip, which can cause pain. So loss of motion. So a significant change in your range of motion of a joint can be an indicator that something is wrong. So noticing, comparing side to side, and looking for differences day to day, or 1 week to the other, and understanding your body. So loss of motion can certainly be an indicator that something's wrong. And then mechanical symptoms. So catching, buckling, locking, feelings of instability can all be signs that something internally is not right inside of a joint. So simple things to try if you're starting to have some joint pain. Modify your activities. Instead of running, try an elliptical. Instead of trying to lift a lot of weight, try lower weights but higher reps. Maybe back off a day and add an extra recovery day in between your exercises. Heat and ice. So heating up before you exercise can be good for your joints and your muscles to get them a little more limber, and then icing down afterwards to avoid inflammation and minimize that. Taking medications, so non-steroidal anti-inflammatories like ibuprofen or Aleve, or natural alternatives like we talked about, turmeric or tart cherry juice, can help decrease soreness and pain after exercise. So pillows, pain at night can happen. It's a very common symptom for joint pain is pain at night. And so, for example, knee pain. So something that can help is sleeping with pillows under and around your knee or between your legs to help prevent knees rubbing together as you sleep. And then if you're to the point that you really need them, sometimes an assistive device is important. So offloading with a cane or a walker even can be beneficial to allow you to continue to exercise while adding a measure of safety and stability. So when to seek medical advice, certainly if there's an acute trauma, so again, an accident or a fall, something like that, any sudden change in function, one day you could you're totally fine the next day. You can't put any weight on your leg, or you can't use your arm. Certainly that's an indication to be evaluated. If it's more of a chronic thing, but you're having significant limitations in your activities of daily living, or you notice that your exercise tolerance is going down because of pain, or your pain is to the point where it's affecting your ability to work, those are certainly indications to seek medical advice. Significant swelling. Swelling can be, again, a marker of something very significant. So it can cause limitations in your range of motion. It can cause considerable pain. And so any significant swelling would be another indication. And then, you've tried all the other things that we talked about and you're still having pain. So persistent symptoms that are not getting better, and you're concerned, certainly a very good reason to seek medical advice. So when you do come to see the physician or medical provider, some common recommendations that you might have during a discussion regarding joint pain are imaging. So a lot of times we'll want to see at least a set of x-rays of the joint, and sometimes we'll order advanced imaging like a CT scan or an MRI to further evaluate the soft tissues in the joint. Lab work, and so if we are concerned that there's a systemic issue going on, an autoimmune disorder or something along those lines, sometimes we order blood work. Formal physical therapy or occupational therapy is often an early stage treatment for a lot of joint pain referrals. Bracing is also a consideration. So for certain conditions, braces allow you to continue your activities and minimize pain. Medications above and beyond over-the-counter anti-inflammatories are sometimes prescribed and often part of the conversation. Injections as well, whether that's a cortisone injection, lubricating injections, or something like a platelet-rich plasma injection. Those are often, again, options that we have in our kitchen sink to help with joint pain. And then surgery, if and when it's needed, is often, again, kind of a typically we think of as a last resort, which could be anything from a small arthroscopic surgery up through a joint replacement, all of which are indicated for different reasons with regard to joint pain. So this is a brief list of patient resource pages. So again, the Arthritis Foundation website. The second one is the American Academy of Hip and Knee Surgeons. So their patient education website deals a lot with arthritis issues, as well as after hip and knee replacement surgery. Orthoinfo.org is website, patient education website run by the American Academy of Orthopedic Surgeons. And so it's a great general resource for musculoskeletal pain. Sportsmed.org is the homepage for the American Academy of Sports Medicine. And so there's a patient education website there related to sports medicine injuries, as well as surgical demonstrations and videos as well. And then ANA.org is the American Association of, the American Arthroscopy Association of North America, which is dedicated to arthroscopic surgery. Again, their patient education website is focused on demonstrations and patient education videos regarding arthroscopic surgery. So with that, here's our contact information, the office phone number. You can find us on the Christ Hospital app through MyChart, the Christ Hospital website. We are available for online scheduling. We do have social media pages that you can follow us on. And I'm going to turn it over to Lauren now, and we'll go through the Q&A if there's any questions.
Thank you, Dr. Palmer. Yeah, if anyone has any questions, feel free to submit those in the Q&A box. Had some comments, Dr. Palmer, some folks are saying thank you for sharing. It was really great information. So thank you for taking us through that. I had a question myself from someone in experience of running outside on concrete versus maybe running inside on a treadmill. Could you maybe talk to us a little bit about long-term effects of one or the other or both?
Yeah, sure. I think big picture, if it's a different experience, right? So if you are having joint pains or have issues that you're recovering from, I think a treadmill is a little bit easier to run on, but there's some limitations to that. So running outside allows more of a natural pace and a gait. If you're concerned about long-term effects, then I would recommend running on flat ground and a well-padded track, or at least flat ground, and avoid uneven surfaces like trail running or uneven breaks in the pavement or sidewalks or whatnot. That can be fall hazards. The treadmill can be a good option for a more low impact way to run because there's a little bit more give to it. It's a little less natural and can affect your gait potentially. If you're like me and you have really long legs, it really screws up how you run. I think that's a good option for bad weather, for winter, for folks who want a little bit less of an impact on their joints. Then running on the treadmill is a great idea. But long-term effects, I think if your gait if you have a good stride, if you have good technique, that there's no real limitations to running outside. I think where people tend to get in trouble is when they don't have good technique, and that leads to other problems with muscle strains and injuries and pains elsewhere.
Great, thank you for that. That was very helpful. Good information. We do have a few questions coming in, so we'll see how many of these we can get through. Someone was asking, can we hear a bit more about the tart cherry juice benefits and how does eating cherries compare?
Tart cherry juice extract has some research behind it suggesting that it has anti-inflammatory effects. It's basically concentrated and sold in a concentrated version to allow you to get enough of it to potentially get the benefits. And so I think if you're eating raw cherries, that's fine. You might not get the same benefit. But if you are going to buy the supplement, I would get the sugar-free kind, so you don't get the downsides of the added sugar. I think it's an option, especially if you want to avoid medications. Then tart cherry juice and turmeric are something that we would advocate for as a supplemental option, avoiding non-steroidal anti-inflammatories.
Great, thank you. Someone also commented on supplements, but I think you may have just answered, but if not, if the person who was asking turmeric in what, please, I think you were probably referring to the tart cherry juice. If that is not correct, please feel free to retype your question in. Another question is there a replacement for cartilage without having an entire joint replacement?
So for certain focal injuries, so in certain joints, yes. So specifically in the knee, there are options for smaller areas of cartilage damage where you can replace the cartilage. So you can do what's called a MACI procedure, MACI, or matrix assisted cartilage implantation, which is a two-stage procedure where we harvest cartilage arthroscopically from your knee and send it to a lab to be grown in a lab. They put your cartilage cells on basically a little sheet of cheesecloth. And then at a second procedure, we can re-implant that over the defect. It takes about a year for that to mature, but it has specific limited indications as well. There's another option with what's called an osteochondral plug, where you can take either a plug from your own, a small area of bone and cartilage from one part of your knee and replace it in another part, or you can take a plug of a cadaver bone and cartilage and replace it in another part. And so again, fairly strict indications for those, and they're not meant for arthritis. They're meant for very focal cartilage injuries. But those are options. Other options include, partial replacements, and you can consider osteotomies potentially, where we cut your bone and reshape your weight-bearing axis of your leg, and that's mostly for knees. Some procedures are similar for hips and shoulders and other big joints, but not as successful and not as widespread or widely done. So,
Okay, thank you. A few more questions here. Can you share the benefit or drawback of using ice for post-surgery or injuries?
Ice is your friend. Ice is great. It helps limit inflammation and limit pain after an injury and after surgery. It can help you recover quicker by limiting significant over amount of swelling, which can inhibit your range of motion and delay your recovery. So ice is definitely your friend.
Thank you. Another question for the Achilles or calcaneus, is it better to see an orthopedic specialist or podiatrist?
So I think both specialists, are well versed in foot and ankle surgery, and so we have orthopedic specialists who have gone through orthopedic surgical residency and then do a fellowship in foot and ankle surgery, who are specialists in Achilles tendons and their treatments. Sports medicine physicians as well oftentimes will treat Achilles tendon injuries. I think if you find a good person that you I think I can say gel with or vibe with, that you get a good feel from, that's the most important thing, because you have folks who are well trained everywhere. So yeah, trying to be a political answer, but I think there's well-trained people who can manage that issue with whoever you feel comfortable with.
Great, thank you. Couple more questions here. Now, is there a better version of turmeric that you should purchase?
Yeah, so when you're looking into supplements like turmeric, the most important thing to look for is that it's verified through a third party lab. And so the quality brands will have their products independently analyzed to prove their quality. And so on the labels at the bottom, usually you'll see a stamp or something that says, independently verified or third party verified by a certain lab. And so I think that's the most important thing when it comes to buying supplements, because they're not regulated by the FDA. So if you go to a supplement store, so somewhere that specializes in that, like the Vitamin Shop or GNC or whatever, ask the representative there, because they should be knowledgeable about that fact, number one. But number two, a lot of times those stores won't even sell the products that aren't third party verified, but that might be different store to store. So that's the most important thing to keep in mind, just that it's third party verified.
Okay, great. Another question, what about toe joints? Do you suggest toe strengtheners for hammer toes or lean toes, or is there another natural remedy for these toe issues? I'm not sure if you're able to elaborate or answer.
Yeah, toes are tough. So especially hammer toes, right? So you have the contractures and whatnot. So a lot of times you're just you're dealing with the problem and finding ways to compensate and deal with it. So whether that's pads or adjusting your shoe wear, sometimes you have if you really need it, if they're bad enough, you have an operation for it. But you're really just trying to live with it and find ways to accommodate for it. So yeah, I wish I had a better answer.
Okay, well, thank you. Another question, if a bone spur is causing Achilles tendonitis, what are the options to heal naturally or risk of surgery if needed? Again, not sure if you're able to elaborate or answer.
Yeah, sure. Yeah, so there's depending on the degree of injury to the tendon, I think that your options are a few things. So certainly strengthening your calf is important. The options range from percutaneous treatments. Sometimes you get a platelet-rich plasma injection. You can do what's called a percutaneous tenotomy, where you try and minimally invasively get the tendon to heal by stimulating a healing response. If you really need to, or the tendon is at risk for rupture, then you can take down the bone spur and reattach the tendon. But certainly that's saved for worst case scenarios. So I guess the worst case would be the tendon ruptures, and then you have to fix it after that. But short of that, you can preempt it by taking down the bone spur and fixing the tendon back down the bone. Again, it's all trying to get the tendon to heal is the most important thing.
Great, thank you. Had another question about turmeric. So someone is asking, are they wasting their time by eating turmeric?
So I guess it depends on how much you're eating. So the concentrations in the dosing of turmeric in the supplements is typically about 500 milligrams per capsule, and the dosing is 2 capsules a day. And so you don't get that significant of a dosage if you're just eating turmeric on your meals. I guess unless you're chewing the root and eating the root raw, you might be able to get it, but that's pretty darn spicy. So I don't know if you're getting. I don't think that you're achieving the levels that you need for the anti-inflammatory effects simply by eating it, but it is certainly part of a healthy diet, and Middle Eastern, Mediterranean, Far Eastern diet, which are fairly healthy. So I would encourage you to continue to do it if you do partake in that kind of a diet, but you might not be getting a full effect, anti-inflammatory effect from it.
Great, thank you. I think that's really helpful. We did have someone ask a question about some elbow pain, but hoping that they could maybe elaborate a little bit more on the kind of pain they're having. So if you could message us back, let us know. But as of right now, Dr. Palmer, that is all of our questions we've had. So thank you, everyone. If anyone does have any follow-up questions or we didn't get to your question, you can absolutely email me and I can get those questions over to Dr. Palmer. I will send a follow-up with his contact information, and I will also be sending the links that he provided, the resources as well, so you guys have those. And with that, next month we are having Lenny from our medical spa do a presentation for us on beautiful skin. So details to follow, I'll send that out as well. But with that, Dr. Palmer, I thank you so much for your time today. This was really, really educational. And I think that everyone had something to take away from this today.
Great, I appreciate it. So somebody sent a question, I see in the Q&A section. It says, does insurance cover PRP or platelet-rich plasma? That's a great question. And the only insurance right now that covers that, I think, is TRICARE, so military. Otherwise, it's an uncovered benefit. So yeah, it is basically fee for service. So it's important to understand when talking to a physician about it.
Okay. Well, thank you guys. Dr. Palmer, thank you again. And I hope everyone enjoys the rest of their week.
Thank you. Thanks, everybody. Appreciate you being here. Those are great questions. Thanks.
Thank you. Bye.